Throat cancer. Yeah, it's a term that can be pretty scary, right? It often feels like this big, unknown thing. Well, our goal today is to pull back the curtain on all of that. We're going to replace that fear with facts and walk you through the entire journey, from the very first subtle signs all the way to what life looks like after treatment. Okay, let's get into it.
So here's how we're going to break this all down. First, we'll decode those subtle signs. Then, we'll get into the surprising rise of HPV and what that means. After that, we'll navigate the different treatment options, including some really cutting-edge stuff, before taking a closer look at what survivorship really looks like.
All right, part 1, decoding the signs. The first thing you need to get is that throat cancer in the beginning is often quiet. It doesn't scream for attention. And this is really, really important because it means you kind of have to be a detective with your own body, paying close attention to those little changes that stick around.
And that brings us to the biggest challenge with catching this early. You've got that sore throat that just won't go away, or maybe a weird little ache. So how do you know? Is it just a cold that's overstaying its welcome, or is it a sign of something more? Well, the answer is all about the details and how long it lasts. Okay, look at this comparison, because the difference is everything. On the left, you have the early stuff, a sore throat that lingers, an earache just on one side. They're subtle, right? So easy to brush off, but they are a whole different ballgame compared to the late symptoms on the right, things like a lump in your neck or spitting up blood. And that gap, that's exactly why you have to take those early signs seriously. So what's the big takeaway here? It's something called the 2-week rule. It's super simple, but super important. If any of those subtle symptoms we just talked about hangs around for more than 2 weeks, or if your doctor gives you antibiotics and it does absolutely nothing, that's your signal. That's the red flag telling you it's time to see a specialist, like an ENT. Okay, on to our second section. Let's talk about what causes throat cancer, because honestly, the story here has totally changed in recent years. We all know about the traditional risks, but the real headline grabber now is the human papillomavirus, or HPV. Of course, the classic risk factors haven't gone anywhere. Smoking and heavy drinking are still absolutely major causes of throat cancer. And just a note, if you do get a diagnosis, quitting smoking is one of the single most powerful things you can do for your outcome. But get ready for this number, because it changes everything. 80%. That's the estimated percentage of unvaccinated, sexually active adults who will get HPV at some point in their lives. It's incredibly common, and it is now the #1 cause of cancers in the middle part of the throat. So how does this work? Well, HPV is a sexually transmitted infection, and it gets to the throat through oral sex. Now, for most people, the vast majority, your immune system just fights it off, no big deal. But for a small group, the virus can stick around. It can just lie dormant for years, sometimes decades, before it decides to cause the changes that lead to cancer. Okay, so after hearing all that about HPV, you might be a little worried. But here's a really important piece of good news. Cancers caused by HPV are different. The tumors that are HPV positive respond much, much better to treatments like radiation and chemo. And that means, on average, patients with these kinds of tumors actually have a better prognosis and a higher survival rate. Which leads us right into our third section, treatment. And the key word to remember here is personalized. There is no cookie-cutter approach. The treatment plan is totally tailored to the patient, the cancer stage, its cause, like HPV, and your overall health. It's almost always a combination of different strategies. So, before any treatment starts, doctors need the full picture. It's a clear 3-step path. It starts with a physical exam and some scans. Then comes the most important step, the biopsy, where they take a tiny piece of tissue to look at. And finally, they use that sample to figure out the cancer stage and to test for biomarkers, which is where they check for things like HPV. Once they have all that info, the team builds a plan using these 5 main tools, usually mixing and matching. Think of surgery and radiation as local strikes. They go right after the tumor in one specific spot. Chemo, on the other hand, is more of a systemic approach, using drugs that travel through the whole body. And then you have the newer, more advanced tools like targeted therapy and the one we're about to dive into, immunotherapy. All right, this next part is seriously cool. This is our 4th section, and it's all about one of the biggest breakthroughs in cancer treatment. It's called immunotherapy. And the fascinating thing is, it doesn't attack the cancer itself. It just unleashes your own immune system to do the job. So, here's the deal.
Cancer cells are sneaky. They're masters of disguise. They can actually put up these little signals that basically tell your immune system, nope, nothing to see here, move along. They make themselves invisible. And this is where immunotherapy is so brilliant. The drugs, which are called checkpoint inhibitors, go in and they find those cancer cells, and they block those don't attack me signals. It's basically like immunotherapy walks up and just rips that invisibility cloak right off. Once that signal is blocked, it's like taking the brakes off your immune system. All of a sudden, your body's T cells can finally see the cancer for what it is, an invader, and they are unleashed to go on the attack. It's pretty amazing, right? You're turning your body into its own best defense.
And that brings us to our final and really important section. Let's talk about what happens next. Because finishing treatment, wow, that's a huge milestone, but it's not the end of the road. It's actually the start of a whole new journey called survivorship, and it comes with its own set of challenges.
And for that new journey, you need a map. That's exactly what a survivorship care plan is. It's this personalized roadmap for your health from here on out. It details the treatments you had, and most importantly, it gives you a clear schedule for follow-ups and solid advice for managing any long-term side effects. Now, radiation is an incredible, life-saving tool, but it can leave some lasting challenges behind. And these aren't just fancy medical words, they're real things survivors deal with. Xerostomia, that's a permanent dry mouth, which can mess with taste and swallowing. Fibrosis is a stiffening of the neck tissues. Trismus, or lockjaw, can make it hard to even open your mouth. And lymphedema is a constant swelling in the neck. Just knowing these things can happen is the first step. So what's the bottom line here? It's all about being proactive. You're not just a passenger anymore. You're in the driver's seat of your long-term health. That means staying away from smoking and heavy drinking forever. It means doing specific stretches to fight that stiffness. It means being really careful with oral hygiene, staying on top of all your follow-up appointments, and getting emotional support. And this last point, it might be the most important of all. You can't ignore the emotional side of this journey. Groups like SPOHANS, which supports people with head and neck cancer, really stress this. You're going to feel a lot of things: fear, anxiety, you name it. The absolute key is to talk about it with your family, a therapist, or especially with a support group of people who just get it. So, as we wrap up, let's leave you with this thought. We've seen how much things have changed, from understanding causes like HPV to these incredible treatments and support systems. So it really makes you ask a new question. What does it truly mean to not just survive cancer, but to actually thrive after it? It's a journey of resilience for sure, and incredible strength.